Senate Bill 848, Senator Gazzone, Public Health Abortion Grant Program Establishment.
Senate Bill 848 is on third reading for final passage. With 29 votes in the affirmative, Senate Bill 848, having received a constitutional majority, is declared passed.
Maryland is set to become the first state to use insurance surcharges for abortions. The Maryland State Senate passed a bill that would establish a public health abortion grant program, tapping into some $25 million collected by Affordable Care Act insurers. A similar version of the bill passed in the State House last week. It was an emotional scene in the House on both sides of the aisle after two delegates expressed their views on the legislation. Let's take a listen.
As someone who has had a transvaginal ultrasound and had an ectopic pregnancy, you do not get those sounds out of your head. It was a medical emergency, and it is not the government's business about what happens to my body when I am meeting with my doctor, and we should not be legislating this stuff.
My niece had a transvaginal ultrasound. Her baby was the size, actually smaller than the size of this bottle. She was told that she should abort the baby because of all of the potential health implications that faced him. He is 4, and he is fantastic. I'm standing for him and for the women that should have the opportunity to make the choice of life.
Dr. Sandy Christensen, a member of the American Association of Pro-Life OBGYNs, issued a statement in response, writing, "Ectopic pregnancy is a tragedy, and my heart goes out to any woman who experiences it. It is important to note that treating an ectopic pregnancy is not the same as induced abortion, which is the intentional killing of a preborn child. Physicians understand this distinction, and thankfully, so do state abortion laws, none of which impede physicians from rapidly addressing this potentially life-threatening condition the way they were trained to do." The two bills must now be reconciled by the State House and Senate before a final version is sent to Maryland Governor Wes Moore's desk to be signed into law. If Moore signs it into law, it would take effect on July 1st. I spoke with Maryland Senate Minority Whip State Senator Justin Reedy, who is a staunch pro-life advocate, about the moves to create this abortion fund. Take a look. Senator Reedy, thank you so much for joining us. Could you tell us what are the implications of this bill should it pass?
Well, it will take money that has been collected from all Maryland insurance ratepayers, and have it go directly to funding abortion in abortion centers around the state of Maryland, with no limit, by the way, on whether it's used even to do abortions for in-state residents and ratepayers themselves, or whether it's going to be used. It's likely going to be used, a lot of it, for out-of-state people coming to Maryland to have an abortion.
And are there reasons this money can't be used to support life and pro-life pregnancy centers, or any other medical issue for that matter?
Well, it's really sad because actually, what happened was when Obamacare passed in 2010, this was a provision of Obamacare. It's like a reverse awful Easter egg, Obamacare. Every time you think you've learned all the bad things about it, you find out years later that there's even more bad stuff. This was a provision of Obamacare that allowed for a state to do this, basically Maryland insurance ratepayers have been paying $1 a month into this fund for years. But Obamacare said you can take this, but you can only do it to provide abortion. So it's really very quietly sinister. And I didn't even know as a state lawmaker that this was necessarily how the law worked, or that this was happening, much less people who were getting it out of their, it's in the fine print apparently on your insurance bill somewhere, but it's definitely very hidden. And so this is $12 a year out of Maryland ratepayers' pockets that can only be used to fund the abortions. And it's abortions. Maryland's law allows abortion at any stage of pregnancy.
That's very disturbing to hear. What would be your message to the people of Maryland?
Well, number one, I would suggest people contact, first of all, if you don't know who your state senator and state delegate are, those are state representatives in Maryland are called delegates in the House of Delegates. one thing I have found is a lot of Maryland folks focus a lot on national politics and government, which is understandable and very important. But knowing who your state legislator is very important. And number two, you should contact your state senator and member or members of House of Delegates and let them know how you feel about this, that this is wrong. There are other states that do this too, by the way. Not every state has done it, but there's a lot of the big sort of so-called blue states like California, New Jersey, and other places. So even your viewers who may be watching who aren't from Maryland, check this out, because it may be that your state's been taking money you may have been paying a monthly fee on your insurance. And insurance is expensive enough, and you've been paying a monthly fee, possibly that's going to perform abortions. And so I would encourage Marylanders to contact their legislators and tell them you want this to stop and that this is wrong. Unfortunately, like I said, I wish I could have offered an amendment to take the $25 million a year and put it spending on something else. We did try to offer amendments to collect statistics and to restrict its use but in a number of ways, but we were not able to offer an amendment to say, hey, take this to support pregnant mothers, needy pregnant mothers, which is what we ought to be doing as a state. So definitely contact your legislators, let them know just how important this issue is to you and that you're watching.
And quickly before we let you go, are there any pro-life bills on the docket?
There's not a lot that has a lot of hope of passing this year in Maryland. We have been putting forward a number of strong pro-life measures, including trying to guard against abortion coercion, which was another amendment we offered on this bill. We also have bills Maryland is one of only 3 states that doesn't have its state health department collect statistics even on how many abortions are performed. So we don't even know how many abortions really are performed in the state, which I think is unconscionable just from a healthcare perspective to not have those statistics. So we've been pushing on those issues. Maryland has a constitutional protection now, sadly, that says that, abortion can be performed any time. So there's not a way, so that's kind of an issue that's in our Constitution, but we need more transparency and accountability for the abortion industry in Maryland. And so we're trying to push to do that.
Well, thank you for the work that you're doing, Senator Reedy, and we'll keep you in our prayers.
Thank you very much. Thanks for having me on today.